Hey everybody, thanks for joining us here on this Tuesday on 9 News Watch. I'm Chris Bianchi with 9 News investigative reporter Chris Vanderveen, who's been very closely tracking COVID here in Colorado. The Omicron variant, of course, present of mind with, it seems like basically everyone has had it at this point. But again, I can say that anecdotally, but I think that the statistics back that up.
Lots of people is the scientific term for how many people have gotten COVID over the last 2 weeks.
Lots of people. On a serious note, it obviously has not been good here in Colorado over the last few weeks. Where do we stand overall in terms of those case numbers?
Well, we have been through a really sort of very, very sharp rise, unprecedented in terms of the pandemic, in terms of how fast things went up. We've been at a level approximately 2 or 3 times the highest peak prior in terms of caseloads. So this was something we had never seen before. This and like what you know is anecdotally, like you've known people at home. You've friends and family have gotten sick on a level that you just didn't see during the pandemic. So it tells you that it was really moving very, very fast. I think, and I caution, because no one likes to make predictions during a pandemic, that we've gotten loads of things wrong. But I think there really is an early sign that we're like right here, if not starting to come down a little bit on the cases. Now, it's going to take a couple weeks for the hospitalizations to take note, and it's going to take even longer than that for some of the deaths to take note. But I think the good news is we may have peaked in terms of our cases, and wouldn't be terribly surprising because you've seen that in other locations as well. They can only go up for so long before things have to start to come down, and I think the caseloads are starting to suggest that here in Colorado.
And is that because of what you were saying, where this variant just burns so hot? Is that it?
I mean, you think about it this way. Once somebody has been infected, there is a good level of protection, particularly people with boosters and everything. There's a good level of protection, and they're not going to get it in 2 weeks. So you've essentially built this sort of wall around a lot of people. 4 weeks ago, basically all of us had some level of susceptibility to the virus. Even with those of us, I have a booster, and I think we had some level of susceptibility because we've all known people that had boosters that got COVID too. And so it was moving through populations that were vulnerable, even the boosted, and now it's starting to lose its momentum because, in at least one part, is that it's burned through so many people so quickly that it's losing places to be hosts. It's losing bodies to be to act as hosts, and because of that, it's starting to move down. Hopefully, cross my fingers, knock on wood, do all the things we're sort of superstitious about. I think the signs are good so far. I really want to see what today's numbers are. I want to see what Friday's numbers are to give us a better idea of what's going on. But so far this week, the numbers have been generally okay in giving us an indication it's starting to turn.
That's in terms of case numbers, though. Hospitalizations are an interesting. There's a unique way that they're being counted. Could you get into the hospitalizations?
It pains me to say this because for a year and a half, if you've followed me, if you've listened to what I've said, I have said over and over and over again, hospitalizations are really the key metric that we can go to on a day-to-day basis, give us a good idea of what's happening with the virus. The problem now is, and this is where it gets a little nuanced, and follow along with me because it gets a little complicated, but it's not too complicated, is that over the last 2 or 3 weeks, we know this from UC Health, we know this from the state, a lot of people that are going to hospitals right now with COVID, meaning they have COVID in their system, but it's not the primary reason why they went to the hospital. And so UC Health said upwards of 2/3 of their patient population that has COVID isn't there primarily because of COVID. So they may have a surgery. So UC Health tests everybody that comes to the hospital. And so when you have the virus swimming around a population as fast as it is, lots of people are going to show up at the hospital for something else, and they're going to test them, and then boom, they have COVID. Doesn't mean that's why they're at the hospital. Now, it's complicating for the hospital because you've got to treat COVID positive patients differently than the rest of the population. But what it shows is that it's now difficult to compare the hospitalizations of today from the hospitalizations of 6 months ago because the patient population is dramatically different. 6 months ago, 5 to 10% of people who showed up at the hospital had what we call incidental COVID. It wasn't the main reason why they were there. Now it could be upwards of 1/3 to 2/3 of all patients that are showing up may have incidental COVID. That's a huge X factor. I call it, for lack of a better term, a lot of noise in the data. And it just means that you can't look at hospitalizations as that tried and true metric right now. So what you're going to hear from a lot of people right now, and honestly, hopefully this just sort of sticks in your head when you hear this. You're going to hear from a lot of people, hospitalizations are as high as they've ever been in the state of Colorado. Well, when you can't compare that anymore. You can't compare the apples of today to the oranges of 6 months ago. And that's what a lot of people are doing because there's too much noise in those numbers now that makes it unreliable to compare it to what happened 6 months ago. I hope that makes sense, but it's really critical to sort of understand what's going on right now because it's far too easy to just scare people with a pandemic. It's been scary enough. But if you're being told the hospitalizations are as high as they've ever been right now and they're not giving perspective to that, they're unnecessarily scaring you, and that's a problem.
So that could be people coming in with like a broken arm or something, and then they have to administer a test, they come back positive, and they're considered to be COVID positive, and they're part of the hospitalization.
And don't get me wrong, for hospitals, the management of it is still tricky. I mean, this is not easy. And I do not say this to suggest that it's any easier for hospitals right now. It's still incredibly difficult in a lot of hospitals right now because there's still a lot of patients, there's not a lot of wiggle room with the beds. But at the same time, it's different than what it was 6 months ago.
So is there any idea where we actually do stand in terms of hospital? How does this compare, for example, to the October-November Delta surge that we have here?
I think the Delta surge, the one metric that I now look towards, at least give us a better idea of what's going on, is ICU bed utilization. You remember about 4 weeks ago, there were days where we had 50 or 60 available ICU beds in the entire state. Now we're averaging about 120 to 160 a day. So we're better today than we were in the Delta surge. Delta was a real problem because a lot of people still end up in the hospital. I've talked to Dr. Michelle Barron, who we've had on our air a lot. She works for UC Health. She said if Omicron had the severity of Delta, meaning it spreads as fast but also puts as many people in the hospital, we'd be in real trouble right now. Think about how fast Omicron spread. If it put the same percentage of people in the ICU and in hospitals, our hospitals would have been overrun a week and a half ago, massively so. But it does tell you that Omicron is just fundamentally different. It doesn't put as many people in the hospital, and in particular, it doesn't put as many people in the ICU, which is critical because ICU patients, the staffing ratios are tricky because you can't, a patient in a bed requires a certain level of help, but a patient in an ICU bed needs even more help, right? There's more, so you have more people that need to help that person. And the staffing ratios get tricky when lots of people end up in ICUs. And I think we saw that with Delta, and thankfully we're not seeing that with Omicron.
Deaths, which can be, of course, a lagging indicator. Where do we stand with
deaths? Went up with Delta for sure. So we were up around, about a month ago, we were about 38 to 40 a day, which was our second highest peak. We've come down, and the data is still, it still seems as if we're going down, but because the death data lags so much, it's really hard to tell what of a net impact there's been from Omicron, because we're only a couple weeks into this Omicron wave, and because of that, those cases, it takes 1 to 2 weeks for a case to become a hospitalization. It takes 1 to 2 weeks, or 1 to 3 weeks, or 4 weeks for a hospitalization to become a death, and so it takes a lot of time for it to move through the system. So we don't know exactly where death's at, but I think the prevailing thought is, particularly in other places that have already gone through Omicron waves, is that it does not lead to an increase in deaths.
Okay, so again, a couple of perhaps silver linings here. Kind of want to transition over to some big news today, which is the free federal COVID tests are now available. If you go to COVID tests, that's plural, covidtests.gov, you can very easily get those 4 free COVID tests. I did it myself. I'll tell you what, it literally took me 30 seconds on my phone. You just sign up, you put in your first, last name. I don't know when you'll get them, but it says you'll get them.
2024.
Yeah, 2020. Exactly.
No.
I kid about that, but I also think back as soon as it became available here in the state of Colorado, which was, about a month ago, I personally have not gotten that. And that's the anecdotal thing.
Yeah, I ordered mine with the state. Still haven't gotten, 3-4 weeks ago, still have not gotten those either.
testing appears to still be an issue. Maybe not quite as bad as it
Testing
was.
is loosening up, and I think that's the net result of what the federal government is doing, and it's also sort of a net result of that people really, really, really wanted to get tested right before Christmas and New Year's, and so there was a huge run on testing, and so what happens is that we're always a few weeks behind, and so there's a little less demand now. The supply is increasing, so it's going to even out a little bit more in the coming weeks. I think it's a good idea to have tests around. I mean, so I was about a week and a half ago started showing symptoms, and was very interested to see, is this COVID or is it not? And I tested myself over the course of, and I'm a little bit different than the normal population, but I tested now 4 times over the course of 9 days, and it was negative every time. It was good to know. I know that the key is that one test is, especially these rapid tests, is not always indicative of what you have or what you don't have. It's important to test, I think, at least twice when you're having symptoms. It's also important when you're having those symptoms. I had a fever, so I didn't come into work last week. It's important, no matter if you have COVID or not, when you're having symptoms, particularly when you have fever, you're transmissible at that point. Don't come in, if you can, don't come into work. Don't hang around a lot of people. But it's good now that testing is going to open up, and I would think that over the next 2 to 4 weeks, you're really going to see availability open up. Combine that with the fact that the federal government is now having insurance companies reimburse for at-home tests is a big deal, and so it makes these free, because you're paying upwards of, for 2 tests. The thought right now is about $23 to $28 for those 2 tests, so anywhere from $12 to $14 per test. That's a lot of money if you're doing a lot of tests. So the federal government is trying to make it easier on people to get those tests. I think you're going to see a huge number of tests coming to the market. I think the only thing that I'm worried about is that this wave, by the time the tests are readily available and all over the place, this wave will have passed us. And that's unfortunate. It really would have been nice to have these tests before this last wave, because give it 2 or 3 weeks, and even us here in Colorado, we're going to have a dramatically different situation here in Colorado, and the demand for testing on a day-to-day basis is going to go way down.
Now, I don't want to get too optimistic about things, but you shared a chart last night based on a potential projection about how case numbers may go here in the Colorado, and it basically went just about down to 0 in the next few months. Explain that, please.
So there's modeling, and we all know, and we've all sort of been versed on sort of the dangers of modeling and looking too much into, and a lot of times the modeling has been really pessimistic. In this case, University of Washington has been consistently putting out modeling for states around the country, including us here in Colorado, and they had a new model that came out late last week, and it shows that we are now, it shows that we're on the tail end of the curve, that we're going down, and we'll be going down quickly. And perhaps by mid-February, which isn't that long from now, we're going to be having very little activity. I will say this, is that minus another variant, I think that is a realistic scenario. And minus an X factor, and we always know there's an X factor with this stupid blasted pandemic, because there just has been one for the last 2 years. I think, interesting, talking about Michelle Barron, I asked her that question, how optimistic are you? And she for the first time sounded relatively optimistic about can we start making spring break plans, that type of thing. Now, again, I don't want to get everyone super excited about something that may not happen, and I think making predictions is foolish, but I think there is reason to be optimistic right now, because we know that this virus is burned so fast and it's going down in locations very, very quickly, and I think it's realistic to expect that here in Colorado as well.
And that's because we're running out of hosts, because
It's just the nature of the virus. And again, I'm not an epidemiologist. I'm sure there's lots of sciences to explain not just running out of hosts. I think running out of hosts is the most obvious one explanation. I think there are other explanations as well. But I think this is what happens when viruses burn super hot. Like it is burned incredibly hot here in Colorado. We have had a lot of people. Everybody at home probably can name at least one person that they know that's gotten sick over the last couple of weeks. That didn't happen. Like we've now lived through this for almost 2 years. on that level, we had not seen that level of people that we know getting sick. And that shows you how fast it was burning, how quickly it was burning. I hope a lot of the folks that do this for a living are right, and I hope there's reason for optimism, because trust me, I think we could all use a dose of optimism right now.
Yeah, I think that's safe to say.
Yeah.
Any final thoughts before we get on out of here?
No, I think this is where it's always, I've said from the beginning, arm yourself with information. We changed what we do here at 9 News, as we discussed before, about hospitalizations, because the most important thing that we can do is add context and perspective into what's going on, and that's what we've been trying to do on a day-to-day basis here, is sort of add perspective, add context, not scare unnecessarily, but provide information. And this is a really pivotal time to sort of start to continue to sort of digest that information. Arm yourself with information. You will make better decisions for yourself, for your family, for your loved ones. That was important back in March of 2020. It's still very, very important now. Make sure you have the best information about what's happening, and then you can make good decisions about what your family can do moving forward. Because lots of people have questions about, well, what can I do in March? What can I do in April? And I think things are trending good. But there's, the X factor, and Michelle Barron said this as well. Dr. Barron said that, look, the virus is still swimming around the world, and we know there's very realistic possibilities of other variants that are popping up, particularly in highly unvaccinated communities. And because of that, I think, should we be throwing parades and saying that the pandemic is over? Absolutely not. But I think minus a new variant coming in, I think things are going to calm down quite considerably over the next few months. Knock on wood.
Knock on wood.
Yeah.
Knock on wood. But Chris Vanderveen, 9 News investigative reporter, we appreciate
You
your
bet.
time here. Appreciate it. We'll be. Thanks for joining us here, and again, we'll have continued updates on COVID here in Colorado over the course of the next few weeks.